Friends of BUSHkids.
I call the member for Ryan.
Thank you, Mr Deputy Speaker. I move the motion relating to BUSHkids in the terms in which it appears on the notice paper. Mr Deputy Speaker, my electorate of Ryan is full of good people doing good things for others. And today I want to thank, congratulate and acknowledge a wonderful group of people who spend much of their lives trying to make things better for young children and their families in regional Queensland. The Royal Queensland Bush Children's Health Scheme, otherwise known as BUSHkids, started in 1935 because the Governor of Queensland was worried about the health and well-being of sick children in the bush during the Great Depression and a long drought. It has continued because good people recognised future generations would suffer more complex and pressing medical conditions unless something was done to provide bush kids with better access to similar primary health services that were available in our city. BUSHkids is a not-for-profit organisation that for 80 years has provided better access to primary health care for children and their families in regional and rural areas right across Queensland. They are supported by a wonderful group of community-spirited healthcare professionals and administration staff located in the heart of my electorate in Toowong. Mr Deputy Speaker, the scope of practice for BUSHkids was slightly different in its early days because the needs of sick children in rural and regional areas and the model of care available to them was found wanting. In its early days, for example, BUSHkids dealt with physical problems like heart defects, lazy eyes, cleft palates, malnutrition, dentures and prosthetic limbs because access to primary health care in remote areas of Queensland was limited or non-existent, and sick children had to travel long distances for the care they needed. Sadly, for those in faraway pockets of Queensland, the time required for travel to get to major regional health centres and the disruption this caused to a struggling family business often meant a sick child did not get the care they needed. We know that a lack of access to primary health care services will result in poorer health outcomes, unnecessary and potentially avoidable complications, and increased hospital admissions. Put simply, people with limited access to primary health care are also significantly disadvantaged in relation to preventative health care. Mr Deputy Speaker, chronic disease is not just an issue for old people, because the development and impact of chronic diseases and their risk factors is a lifelong process. Chronic disease is a major cause of loss of life and disability in all age groups, varying from more than 70% in children up to the age of 14 and up to 95% for elderly people over 65 years of age. The prevention of chronic disease requires the implementation of interventions that target young people, as well as broader interventions for the whole population wherever they live and work. Importantly, health systems that include strong primary health care are more efficient, have lower rates of hospitalisation, fewer health inequalities and better health outcomes, including lower mortality. In effect, we now know that establishing stronger personal and community links to primary health care information and services in regional and rural Queensland will reduce preventable illness and its cumulative impact on a person's health and well-being, as well as hospital demand. That more and better primary health care services are now accessible to sick children and their families in rural and remote Queensland is in part due to the pioneering spirit of BUSHkids' early health practitioners, their patients and their supporters. They have a long record of distinguished service to rural and remote communities in Queensland. For example, BUSHkids has played a vital role in helping sick and troubled children get better and keeping families and communities together. BUSHkids has helped nearly 45,000 sick children in remote and rural Queensland get the health care that they need. This is a truly remarkable achievement. While access to better primary health care services for children in regional and remote Queensland has improved greatly over the past 80 years, there is still a need for better access to allied health services. And BUSHkids relies on generous donations from members of the public in order to be able to continue its valuable work. Madam Deputy Speaker, healthcare itself is on a journey where the emphasis of care is shifting into extending wellness and improving health. The link between health and education runs both ways and is far more complex than simple cause and effect. Poor health impacts on children's ability to learn, and vice versa. There is evidence by the high levels of ear disease and permanent hearing damage experienced by young Indigenous children, with hearing loss leading to linguistic, social and learning difficulties, as well as behavioural problems in schools. This in turn reduces educational outcomes that will have lifelong consequences for employment, income and social success. Through greater responsibility, ownership and understanding of the importance of personal health management at a younger age, a much better long-term health outcome for young people and their families, as well as the taxpayer, is achievable. Put simply, prevention of disease or early intervention so an illness does not grow into an acute episode is the best outcome for the patient, their family and the taxpayer. Madam Deputy Speaker, BUSHkids is uniquely placed to continue its crucial role in early identification, prevention and intervention in respect of health, education and social issues that affect children and their families in rural communities. In rural and remote Queensland today, for example, there is a growing trend in early childhood development and behavioural issues associated with broader family and community challenges such as the fly-in, fly-out work, ongoing drought, family breakups and drug and alcohol-related social issues. In responding to this challenge and recognising the range of primary health services available, BUSHkids now offers early intervention strategies that include parents, family and community education. Complementary models of care that include allied health and other primary health care management alternatives are effective in improving clinical management of patients and freeing up specialist appointments. Madam Deputy Speaker, BUSHkids now has fully supported centres based in Emerald, Dalby, Bundaberg, Mount Isa and Warwick, and a sixth centre at Inglewood serviced by a family health care support worker. Dedicated allied health professionals in regional Queensland provide early intervention, development and therapy services to improve the health and well-being of children with or at risk of developmental and other difficulties. BUSHkids speech-language pathologists reduce the incidence and impact of communication and eating difficulties through assessment, diagnosis and treatment of children with speech-language, voice fluency, literacy and eating difficulties. BUSHkids occupational therapists assess the skills which can impact on a child's participation in their self-care, play and school activities. BUSHkids psychologists help reduce the incidence and impact of emotional, social, academic and behavioural difficulties. And BUSHkids family health support workers support allied health professionals by providing a range of education and skill development programs to children, their parents and or caregivers. And with early intervention facilitators located in Agnes Waters, Miriam Vale, Kinroy Nanango and Stanthorpe, BUSHkids provide even more rural and regional Queensland children and their families with better access to allied health professionals in partnership with other government and non-government healthcare providers. Madam Deputy Speaker, the need for our BUSHkids programs is compelling, and I'm sure your own electorate of Durack would benefit from these services. Increasing evidence shows we should front-load early intervention and innovative primary care management options to when and where people need them, instead of moving a very expensive ambulance to the bottom of a cliff. Indeed, the World Health Organization has long argued resource allocation clusters around curative services at great cost, thereby neglecting the potential of primary prevention and healthcare promotion to prevent the vast majority of the disease burden. Madam Deputy Speaker, I'm honoured to be the patron of Brisbane BUSHkids in Brisbane, which is a crucial link between city and country. I applaud BUSHkids for its 80-year record of service and for putting the changing health and wellness needs of rural kids at the centre of its scope of practice, and for remaining true to the timeless principle of Hippocrates. The function of protecting and developing health must rank even above that of restoring it when it is impaired. Madam Deputy Speaker, Friends of BUSHkids is a community-based group designed to promote engagement with the services they provide, so it is at the forefront of emerging health issues and is the best possible advocate for improving the health and welfare of rural children. I encourage all members, particularly Queenslanders, to support the Friends of BUSHkids in their electorates, and I commend this motion to the House.